Welcome back in. Great to have you here on WKYT. September is Prostate Cancer Awareness Month, and for men, there are a lot of unknowns and a lot of questions, uncertainty, certainly.
And to talk more about it, we're joined by Dr. George Privett and Davonna Saier with Lexington Diagnostic Center and Open MRI. Thanks for coming in.
Thank you for having us.
You
we have
want
a little game
You're
for
going to
you.
play a game with
we are ready to go
See
here.
how smart you are.
Uh-oh.
So there's a lot that's not known about prostate cancer, and it's a hot topic for men and for their families that are affected. So I'm going to say a statement, and you decide if it's true or false. Dr. Privett will tell us if we're correct.
All right.
So this first one's easy. When talking about prostate cancer, PSA stands for pretty silly activity. True or false?
There you go. It's
Okay.
false.
All right, yes, both correct.
I don't know what it stands for.
PSA stands for prostate-specific antigen. It's a substance that's produced by the prostate. We're not entirely sure what it does, but there's some produced normally, and then when you get tumors or other infections, the level can go up, and it's an indicator in the blood that we use for helping to diagnose prostate cancer.
Need further study after you find that out.
That's right.
Yeah.
Okay, here's another one. If diagnosed with prostate cancer, surgery is only one of many options.
I would say
Probably.
We got some
I'm
smart
good.
people
We're
here.
agreeing
you,
with
you guys are right. You've been studying last night or something. Yeah, but surgery is one of the options, but there are many others. One of the biggest options that we're learning now is because prostate cancer is so indolent and slow growing in most people, the tumors may outlive you, is to do what's called watchful waiting or active surveillance. That is, just follow it along because it's not an urgent thing. If it does get to the point that it seems that it's could be more serious, and there's hormone treatments, there's radiation treatments, there's freezing treatments, there's ultrasound, focused ultrasound treatments. So there's a whole lot of options right now, and they're all changing. And I would advise all men who think they might have prostate cancer to get lots of opinions and to study about it a lot before. Don't make any rash decisions.
Dr. Privett, what advice do you give men who are apprehensive about coming in at all? Number one, the tests themselves and what news they may find.
Goodness, it can be daunting, but it's just a matter of saying, look, this is maybe a problem I'm going to have, and I need to find out about it. And if it's something that is benign and I don't need to worry about, then I can stop worrying. If it's serious, then we'll go on and do some more tests. But the big thing right now is that we're able to do is to try to diagnose prostate cancer using the MRI. If you have a 3 Tesla MRI, we do a procedure called multiparametric MRI that allows the radiologist and the urologist or the cancer treatment doctor to look at it and see, is there evidence of cancer, number one, and if there's not, then you can follow it along. If there is evidence of cancer, then you get it localized, and the urologist would know where to target it for a biopsy.
We don't have time for our next
That's
question,
okay.
which means that we end with perfect scores.
That's exactly
And a lot of good information,
Good
so we
job.
certainly
We do
appreciate
yes.
it.
Very good
Thank you all
info.
for coming
Thank you.
in.
Thank you.